Imagine a 30-year-old man walking into a clinic, complaining of chest pain and shortness of breath. The nurse takes his blood pressure and it reads 190/120 mmHg. What could possibly be going on? Firstly, the chest pain. It's a symptom that can be associated with numerous health conditions, some minor, others potentially life-threatening. It could be the result of heart disease, lung conditions, gastrointestinal problems, or even panic disorders. But in this case, we need to consider it in conjunction with the patient's other symptoms. Next, the dyspnea, or shortness of breath. This symptom is often associated with heart or lung conditions, but it can also be a sign of severe anxiety or high blood pressure. It's a distressing symptom that can lead to feelings of panic and anxiety, which could potentially exacerbate the chest pain. The blood pressure reading of 190/120 mmHg is significantly higher than the normal range of 120/80 mmHg. This is a clear indication of hypertension, a condition that can lead to serious health problems if not managed properly. Hypertension can cause damage to the arteries, heart, brain, kidneys, and eyes, and it can also lead to stroke and heart failure. It's a silent killer because it often doesn't cause symptoms until it's too late. So, putting these symptoms together, we can make a preliminary diagnosis of hypertensive emergency. This condition occurs when blood pressure becomes very high, very quickly, and it can damage the organs in the body. The chest pain and shortness of breath in this case are likely a result of this damage. In terms of management, hypertensive emergency requires immediate treatment to lower blood pressure. This often involves the use of intravenous, IV, antihypertensive medications. The goal is not to lower the blood pressure to normal right away, but to reduce it by no more than 25% within the first hour, and then to 160/100 mmHg over the next 2 to 6 hours. But remember, each patient is unique, and treatment should always be tailored to the individual's needs. It's not just about managing the symptoms, but also about addressing the underlying cause of the hypertension and preventing further organ damage. So there you have it, a 30-year-old man with chest pain, shortness of breath, and a blood pressure reading of 190/120 mmHg, a likely diagnosis of hypertensive emergency, requiring immediate treatment to lower the blood pressure and prevent further organ damage. It's a reminder of the importance of regular health checkups to detect and manage conditions like hypertension before they become emergencies.